So there are two things that you want to think about when it comes to your health during retirement. The first is pre-existing medical conditions. What is a pre-existing medical condition? Now, these things are defined as a medical condition that you may have and continue to have while you're retired. For example, things like diabetes, an injury, or any kind of chronic ailments that you have. The reason you want to consider this into your retirement planning is the ongoing cost of treating these conditions. For example, with medication, regular doctor's visits, or any other kinds of specialist attention. The second thing you want to think about when it comes to your health during retirement is your insurance coverage. There's a common misconception where people think you need all kinds and as much insurance as possible when you're retired. That's not necessarily true. Here at Trust Refinance, we say you only need 4 kinds of insurance during retirement. The first is outpatient treatment. Outpatient treatment is defined as going to a clinic or a general practitioner, or the GP, for things like a cough and a cold or minor injuries. The second thing you want to consider getting when you're retired is what we call a Hospitalization and Surgical Plan, or HNS. When we're retired, and especially as we get older, the likelihood of us visiting a hospital for treatments or surgeries may be higher. And so having a HNS plan which covers you for all your hospital bills will definitely come in handy. Depending on which country you're retiring in, HNS coverage may already be included or even be mandatory made by that government of that country. The third kind of insurance you need to consider is what we call a personal accident plan. A personal accident plan really covers you for injuries and conditions which may not necessarily be covered by your hospital plan. As we said earlier, if you're a bit older, you can be a little bit more accident prone. Little injuries, sprains, even a broken bone. So you'll need a personal accident plan which covers you for all these little injuries that you'll encounter during retirement. And the fourth type of insurance that you may want to consider getting is what we call a critical illness plan. There are plenty of critical illness plans out there. A critical illness plan, or a CI plan, will usually cover you for major illnesses such as cancers, strokes, heart disease, and so on. Now, you may want to consider looking for a plan that suits your needs. So look for a plan that suits your needs. You'll need one that covers for the treatments while you're in hospital as well as treatments outside of hospital. Generally, CI plans will pay you a lump sum upon the diagnosis. Some of the plans out there may also pay for your surgeries and other treatments. Not necessarily experimental treatments, but treatments nonetheless. So those are the two main things regarding your health when you plan your retirement. Pre-existing medical conditions and the kinds of insurance you need. This is Afiq from Trust Refinance. If you like any of our videos, hit subscribe and you'll be the first to view our new videos. We do this just for you.